Now, the Health Secretary's called for action to improve mortality rates after a report suggested that people in Britain are more likely to die early than those in most other wealthy nations. It comes after researchers found that tobacco and alcohol use, obesity and poor diet have all left the UK near the bottom of an international league table for ill health. Jeremy Hunt called the findings shocking. Sky's Jason Farrell reports.
They live longer in southern Europe. For the secret to healthy life, go no further than this Made in Italy restaurant in Notting Hill and talk to Giuseppe.
Rhythm of life you have in Italy, it is much more relaxed and you've got much more time to spend with your family and to enjoy the moments. You know, there's much less stress compared to here.
The UK is now 12th out of 19 Western countries for healthy life expectancy. This was partly due to a dramatic growth in diseases linked to drugs and alcohol. Britons have an average 68.5 years of healthy life, whereas people in top-ranked country Spain have 71 years, and Italy clocks in at over 70. Smoking was the top reason for an early death in the UK, followed by high blood pressure and obesity. In response, the government's now calling on the NHS to focus on the 5 biggest killers: heart disease, cancer, respiratory disease, liver disease and strokes.
That's great, and now if you open your eyes...
London at least has recently improved its stroke mortality rates by 28%. They did this by setting up fast-track hyperacute units, such as this one at Charing Cross Hospital. All this requires money. There was £23 million invested to create London's 8 hyperacute stroke units. But treatment isn't the only solution.
Clearly there is work that we're doing in terms of integrating our services between both the GP services and the hospital-based services to identify those patients at risk and to make sure we get the interventions early on to prevent them having the stroke that then necessitates the hospital admission.
Prevention of disease through healthier living is the key message of today's report. But has it reached these diners in the Red Lion in Manchester?
The expensive food as well is a big part of it, you know. To be honest, you know, a fry-up here is cheaper than a salad. Mine's nearly twice the price.
The women don't cook now like they used to do, and they've got such busy lives. They find that it's easier to go out to eat a lot.
It's a guidance, isn't it? It's not a stipulation. There's no legislation or anything on it. My wife tells me to eat very well, so when I'm at home I eat very well.
It's a wake-up call, say report authors. On a diet of alcohol and greasy food, the UK is sliding to the wrong end of the death rate chart. Jason Farrell, Sky News.
Well, what to do? We're joined from central London by the Chief Executive of Health 2020, Julia Manning, and Professor Len Shackleton from the Institute of Economic Affairs. Thank you both for joining us. Professor Shackleton, if I could start with you, is this a wake-up call? Should we react to it?
I think at a personal level we probably should, but whether the government should do anything about it is rather different, I think. I think the government should concentrate on improving and reforming the health service rather than badgering us to change our diet.
What do you think, Julia Manning? I mean, I remember when people used to drive without seatbelts and the government fixed that, didn't they?
Absolutely, that was one of the very important public health interventions. There have been many. I think what this report shows today is that we need to go further. We need to invest more in public health. And it is a personal responsibility, but it's also a government responsibility. They have a duty of care, and they have to look at when so many poor choices are being made that they have to intervene. And I think this report is telling the government they need to intervene.
It's interesting, isn't it, Professor Shackleton, because many would sympathise with the view that we should be left to live the lives we want, the way we want to, but there is this phrase, duty of care, which a government must feel. And if the country's smoking itself to death and costing the National Health Service a fortune in repairing the damage or helping them through an ugly and early death, they should do something about that, shouldn't they?
Well, it's a very slippery slope, I think. There are many interventions which we could ban a whole range of things which we know harm people's health. We could ban divorce, for example, because we know that people who get divorced suffer from mental illness and various other problems. We could ban marriage amongst first cousins because we know that predisposes to certain disabilities. We could ban cooking with ghee, which is a major cause of heart disease amongst South Asian communities. There's all sorts of things we could do. Where do you draw the line? You're just imposing a lot of regulation which has no real proven benefits.
Can you not at least make the information available to people? I mean, there are plenty of people out there, Professor Shackleton, who simply don't know the difference or don't understand cause and effect.
Andrew, you underestimate your fellow citizens. We know a lot about health. People haven't carried on smoking because they don't know that smoking is bad for them. People don't carry on eating junk food because they don't know it's bad for them. They have other reasons for doing so. You and I may have different priorities in our lives, but who are we to impose our choices upon the rest of the community?
Julia Manning?
Well, when we make poor choices and we drink too much and we eat too much, we are imposing our choices on the rest of the community, because the taxpayer has to pick up the burden of us becoming obese, suffering heart disease. I mean, 4 out of 5 of the top killers are impacted by food, by drink, by obesity. So the choice for the government is, at what point do they start intervening? And I think this report shows us that they do need to intervene. More needs to be done to not just to educate, but to actually put in some specific measures so that we are making better choices, and particularly for younger people, for children. Because if you don't capture children, people when they're young, and help them to make good choices, then it's much, much harder when people are older.
OK, but Julia Manning, what about Len Shackleton's point? That, we can't be telling people if they want to eat junk food, if they want to smoke, they're doing it willingly and in full knowledge that they could be shortening their lives. So it's their free choice.
Well, he's right with smoking. People do know that it's bad for them. The public health campaigning around that, which has taken several decades and has reaped rewards, and we're smoking less than we used to. But unfortunately, over the past 20 years, rates of obesity have gone up 63%. So we now, it's not a sort of, we've done smoking and that's it. We now need to look at what we're eating and what we're drinking. And we need to be educating children about nutrition. Our food labelling is complete nonsense. It should be about how nutritional the product is and how much sugar there is in it, not about fat or it should be useful information on vitamins, minerals, how healthy is this food. There's an awful lot that we could be doing that we're not doing.
Is there not, Professor Shackleton, is there not some resistance to the prospect of a workforce that start to suffer from things like diabetes and obesity? Is there not a formula that the economists and the CEOs would like to employ to keep people healthier as a workforce?
Well, I don't know what we're talking about here. We're talking about the best way to do this, if you believe it's government's responsibility. I mean, why not have a fat tax, a genuine fat tax on fat people, for example? If that is the problem, why not charge people a higher rate of tax if they're overweight or something like that? Because if the sole issue is about saving money for the taxpayer, that's the kind of lines we ought to be thinking on. The kind of regulation, this widespread regulation which Julia's talking about, could hit just about everything, will be extremely expensive. British business is already overburdened with regulation. We don't want more of it.
But do you not feel within that somewhere, Professor Shackleton, some sort of a holistic need to fix or tackle this problem from one side or the other, or do you feel better just to leave it and let it run its course?
I actually think things are rather better than this report has suggested. The figures for the UK in terms of life expectancy don't really take into account the fact that we have a very diverse population. Amongst different groups, life expectancy varies very considerably. And amongst middle-class people in Britain, their life expectancy is equivalent to that in most other countries. We have a range of people who are not in that category, and maybe if you want to target anything, it should be targeted at these people rather than across the board action against fat, against alcohol and so forth.
OK, Julia Manning, final thought?
I think that the priority needs to be early intervention. We need to start when people are young. We need to start in schools educating children. And if there are health issues for children, we need to be picking up on them. It should not be an option. It should be a mandatory intervention.
Julia Manning, thanks very much indeed for joining us this afternoon. Our thanks also to Professor Len Shackleton for joining us as well. Thank you both.